Is it allergies or a cold? Most importantly, we want to ask, what are the differences in symptoms? Unfortunately, that's kind of difficult with allergies and a cold because a lot of the symptoms are very similar. You tend to get a runny nose, you tend to get a lot of mucus that can make you feel tired. Usually, though, with a cold, sometimes you can tell a difference in the way someone's symptoms will appear. Did they kind of hit really hard all of a sudden? Did they come with a lot of fatigue, a real bad sore throat? Did you have a fever, body aches and pains? These are kind of subtle differences that can suggest to us, okay, we're dealing with a viral infection as opposed to a reaction to something in the environment. How do you treat them differently? Allergies can actually usually be treated pretty effectively with over-the-counter medications, and in the case of issues with the nose, nasal irrigation. A cold can be helped a little bit by things like nasal irrigation, but you have to treat the symptoms in a different manner because a different process is occurring. You want to use more of the pain reliever medications and the nasal decongestants, things to address congestion, because allergy medication really won't help that much for most people. When should you seek medical attention? So, first of all, if you keep having recurrent symptoms and they're really bothersome, that's a good sign you have allergies, but it's also a good sign that you should seek medical attention so that we can make sure that something else isn't going on or that there's not a prescription medication which could make a difference. If you have a cold, depending on the symptoms and how troublesome they are, it can be beneficial to seek medical attention. The chief issue is, are they prolonged? In other words, if I have a really bad cold, it lasts for 5 or 6 days, and then I'm stuck with this nasty cough, other than over-the-counter medications, there's not much we can do. But if you had a little mild fever, you got a little bit better, and now all of a sudden, that cold is back. It's much worse, and your fever has gone way higher. You feel more fatigued. You've got massive headaches. That is a good sign you need to seek medical attention. And certainly if you're having trouble breathing, then it's likely not allergies. It may not even be a cold. It may be something more severe that does need prescription medication like antibiotics.